Hi, everyone. I see we have folks continuing to join. Thank you for being here today. And I want to welcome you, of course, to the Foundation's 2026 Global Virtual Conference session for the Marfan Foundation and all of our divisions. Today, you're here for Family Dynamics in the Context of Genetic Aortic Conditions. My name is April Donchinsky. I'm the Chief Communications and Marketing Officer for the Foundation. My colleague Elva, who runs our administrative office management, is here helping us today. Thank you so much, Elva. And I do want to let everyone know that this session is being recorded. Before we begin, just some housekeeping. I want to let you know that Zoom's Q&A feature to submit questions throughout the presentation is available to you. We're going to answer as many of those questions as we can during Q&A at the end. Our speakers have let us know that they are super interested in Q&A for this and really invite your questions. So please use that Q&A tab rather than the chat for questions, as that will be the best way for me to retrieve them for you and convey them to the speakers today. And now I'm going to introduce you to Maya Brown-Zimmerman and John Aimo. It is a pleasure to introduce both of them. They're going to tell you more about themselves. And Maya and John, I turn it over to you.
Okay, sounds great. Let me get things shared.
Good morning, guys. Can you see me okay?
Yes. Okay. Everybody able to see the slides?
Yes.
Okay. So to introduce myself, I am one of the three Ps, so to speak: a patient, a parent to an affected teenager, and a provider. I've been volunteering with the foundation in one capacity or another for over 20 years. And currently I work as a cardiogenetic counselor. I'm an advisor to the Marfan Foundation's Professional Advisory Board and their board of directors. And I live with my family in Louisville, Kentucky. John?
Hey, guys. Good morning. Um, my name is John, and my background is in recreation administration, which I worked on like adaptive lifestyles and sports. Um, for over 30 years, for almost 30 years, I worked in the grocery industry. I'm currently pursuing a degree to be a marriage and family therapist. I've enjoyed volunteering at Camp Victory in California and Georgia, and also participate in other foundational activities. And I live up in Northern California in a little town called Chico.
All right. So sometimes a new diagnosis comes to a family and everybody is happy to have an answer. They're all supportive and everybody honors appropriate boundaries. And that's great when that happens. But I think that for many of us, we've had experiences that, at least for a time, were challenging. And maybe it took a while to get to that point, or we're still working towards that point. So we're going to be talking about different ways that a diagnosis can stretch a family. It may be triggering to hear about situations similar to yours. But after I'm done talking, John is going to follow this up with actionable steps to help. And my hope is that by acknowledging these challenges, that it will also be validating. So that you know that you're not alone if you are feeling this way within your family. So one of the challenges that we can face is disbelief. And this can start even before the diagnosis. So family members may not believe you or your loved one's health issues, or they may not support your mission to get a diagnosis for whatever reason. Maybe they don't think that it's going to help anything, or they just don't see the health issues as warranting further looking into. Once a diagnosis comes, guilt can be a common emotion, particularly within parents. I hear a lot, "This is my fault." And while parental guilt is common, I want to reiterate that even if you have an affected child, this is not your fault. We do not control our genes. It does not matter if you knew about the diagnosis before you had kids, or if you found out after your child was diagnosed. You did not make the choice to pass on the condition. You didn't choose how your child would be affected. And so try to remind yourself that this is something that was outside of your control. There's also survivor's guilt. And so family members who are unaffected may feel guilty that they don't have to have the same doctor's appointments or surgeries or other issues that their loved one is facing. Sometimes survivor's guilt can cause a person to kind of distance themselves from the family member. because they're not really sure how to, acknowledge the challenges that their loved one is going through, or how to interact with them anymore given the diagnosis. And then one I don't think we talk about as much is guilt on the patient's part for how the family is impacted. I know that I was very aware of the medical bills and how much that my family had to spend on my care. Um, People may see that, they're not going on vacations because they've got doctor's appointments or surgeries, or they may pick up on the stress that other family members are feeling revolving around their diagnosis. And this can happen even with kids. And so it's important to address these issues kind of preemptively. And I'll talk a little bit more about that in a few slides. And then we have denial. So there may be denial about the legitimacy of the diagnosis. I don't see how this genetic test report changes anything. You look fine to me. So I don't think that there's anything going on. Or denial about the consequences. So, okay, maybe you have this condition, but I don't really believe that you need to take medicine for it or make any changes to your activities or anything like that, which can feel very invalidating if you were the affected person. And then denial about their own risk in an affected person. So I see this most often in talking with like the romantic partner of somebody who's affected, and maybe they feel some frustration because their loved one doesn't want to take medicine, doesn't want to go to the doctor, doesn't want to, have a recommended surgery. And they're trying to figure out how to navigate that without it imploding the relationship, or how to get care for their kids if the other parent, doesn't want to get care for themselves. And so that can be very challenging. Anger can be a particularly complicated emotion to navigate, especially if it feels unwarranted. Sometimes following a diagnosis, the affected person will go to their family members and say, "Hey, I have this. There's, a 50% chance of you having it too. Here's how you can get genetic testing, or this is the doctor you need to see." And family members may be very angry and say, "You've opened up Pandora's box. Our lives were just fine until you had to go looking into it. And now you've introduced the stress that we didn't want to have." And so then they turn the anger on the person with the diagnosis because they were the one to, really kind of upend their lives. Um, and now these family members have to decide, do they want to get the genetic testing? Do they want to go to the doctor? Do they want to just wait and kind of see what happens and not go down that road? And so there can be anger from that. There can also be anger from what's lost. So plans that they had that have changed because of the diagnosis, or just other life changes. So all of a sudden life isn't what you thought it was going to be because you or your loved one received this diagnosis. Could be, oh, we were going to go on vacation and now we find out we have to have surgery in the next few months. Or, a longer term, wow, now I don't know what the future is going to hold. And then there's stress. So that may come from anxiety about the future, both long and short term. So again, is my loved one going to be able to have a job, have kids, or again, stress about upcoming surgeries? There may be disagreement over management. So for instance, the extended family not supporting rules in place. Say that in your family, you've decided that your affected kids are not going to do roller coasters, but they go spend some time with grandma and grandpa who take them to go do roller coasters because grandma and grandpa don't think that that's a problem and they don't honor that boundary. And so there can be a lot of emotions around boundaries not being honored. And then when you have these large families where many people are affected, there can be stress over choosing to handle it differently. So maybe you and most of your siblings all have VEDS, and some of you take medication and some of you don't. And some of you work out at the gym and others don't. And so now there's, worry about those who are handling the diagnosis differently, or your kids are wondering why their cousins can do some things that you can't do, or vice versa. And Also, stress about finances. Having these diagnoses is not cheap. Um, with copays and medical bills and surgeries and travel to and from appointments because not everybody lives somewhere where have access to healthcare in your own town. Um, that can definitely put stress on relationships both in and outside of a household. And I think it's worth talking about siblings and that relationship in particular. I used to write a blog about living with Marfan, and I once interviewed my brother as an adult about how he perceived my diagnosis growing up. I was diagnosed at 8, so he was 6 at the time. And he confessed that for a while, he thought I was going to become the next Shaquille O'Neal. And for those of you who are younger, Shaq was a very big basketball player in the 90s. So my brother thought I was going to become the next Shaq and that I would make him millions of dollars and he would be rich. But later on, once he understood more about Marfan, he told me that he laid awake at night and he wondered if I was going to die. Our mom had no idea that he had any of those thoughts until that blog post was published when we were both in our mid to late 20s. Kids are aware of more than we might give them credit for. And I think it's vital that parents provide opportunities for having hard conversations so that if and when they're ready to talk, the kids know that it's okay to. If the adults aren't talking about it, kids can easily interpret that as that it's wrong to talk about, either because it's inappropriate, it's not their business, or it's going to upset their parents. And so as the adults, we have to bridge that even before our kids are asking questions to let them know that it's okay to have those questions. So when you have siblings that are mixed in terms of diagnosis and no diagnosis, education is important so that they're receiving accurate information about what the diagnosis means for their sibling and or parents and what that means in their household. There can also be jealousy. I mean, I think there's jealousy between most siblings, diagnosis or not, but if one has Marfan and the other doesn't, there may be jealousy over, well, the sibling with Marfan gets to have the parents for these appointments and they spend time with them when they're in the hospital and they get a special treat when they have their echo, and I don't get that. And conversely, the affected sibling may be jealous that their siblings don't have to do those things or that they get to do some other activities that they're not able to. And again, acknowledging this, talking it through can help these relationships. And finally, helping everybody kind of find their niche. I've heard sometimes where families will, ban an activity, say, okay, my one child can't play football, so no one's going to play football. And I would kind of caution against that thinking because everybody's different. And if you put in rules like that, it can then create the jealousy. Um, but helping everybody realize that they have their own way of shining and things that they can do well can help those relationships. And now I'm going to turn it over to John to talk about family dynamics and therapeutic solutions.
Good morning, guys. Thank you, Maya. Those were relevant things that I wish I could be interacting with the people watching this right now because I'm hoping that they could really relate to those. And I'm going to open with a personal story about family and managing Marfans. My desire is that the stories I do share are ones that will resonate with you and find empowering meaning. And my prayer is that when we leave this time today, that there'll be a new hope that's instilled. See, about 9 years ago, I was at the Marfans conference, and a buddy of mine, his heart the first time. That day, there was about 80 echoes, and I was there in the waiting room while he was getting his scan, and I saw all these faces coming out of their different offices and with different emotions on it. Some had relief, some shock, confusion, disbelief. I saw one gentleman who had glassy eyed and he was tearing up. And what I realized was here I was with my buddy, and just 5 days later, we were at his funeral. and his aorta did erupt. And when I was there at this funeral, um, I saw his siblings, his cousin, and everyone's in their 30s and 40s. And I realized that his family is really just like my family, like many of your families, where people have taken different approaches to handling it. And quite often it's just denial or really want to it doesn't hurt. And so um, that's what we're talking about today is how family influences each other. And I responded uh, earlier in life, like my dad had handled it, and much like my grandma had handled it. Um, and I and so that's what we're gonna. So just wondering, can you guys hear me? Okay, my internet's
Yeah,
good. Okay, cool. My
Pretty close, John. Occasionally a word or two is missed, but we'll let you know if that gets worse. It's okay for now.
All right, thank you. I just saw a flash on my screen that says internet was unstable. Universal conferences are very wonderful, but now there's technical challenges. So let me open up with just what family dynamics are and how people interact, communicate, and uh, the dynamic of the system are the rules governing individual behaviors within our system. And they vary between each family. Quite often these expectations are given verbally and often so schools would make the
Actually,
decisions
John,
for the
you're starting to,
house.
we're getting some feedback in the chat that it is glitching. Maya, I don't know if you would want to read through some of John's notes here, and we can try to go back to John in Q&A because we are having, I think, a little bit of internet instability on your end, John.
yeah, I can read the
Thank
notes
you.
for
I
this.
apologize.
No
Uh,
worries. We appreciate you being here. No problem, John. Thank you.
Um, okay, so I'm gonna read the notes that John has here. So what are family dynamics? Family dynamics are how family members interact with one another. The dynamics of the system are the rules that govern individual behaviors within the system. These can vary greatly from family to family. Rules can be given verbally and often non-verbally. Some examples. Who's making the decisions? Who calms things down within the family? So, meaning like the peacemaker, which John said is usually him. Who tends to argue? What family members are closer to each other and what family members are more distant from each other? So, John says that within my family system, the rule is that we don't talk about Marfan. This was usually expressed non-verbally, or my father preferred to live in complete denial. It wasn't until I started coming to these conferences in my early 20s that I learned that the mutation is passed down from one of my parents. I came home excited to share this new finding, and my dad told me that it did not come from him. But I was like, wait, you had emergency open heart surgery, and grandma had it when I was 6. But unfortunately, John said, my dad was never able to embrace this part of him. This is very different than the family that I was recently talking about, where the mother wholeheartedly expressed that the 2 children got checked, one had the gene, and we were on this journey together. I was moved by this mother's love.
John, if you want to try again for a minute and see.
Excellent. Let's give this another try. Um, so what I found was that when my needs were ignored, that it became like a loss of dignity, that my whole self wasn't being acknowledged within my family. And also uh, there's there was times that I was excluded from family activities, sports, work, business opportunities, and hobbies, and I just wasn't allowed to participate. And so versus maybe making an adjustment or make have an alternative or finding things that are within my wheelhouse or within my desires. So what me and my cousins have done is we've actually kind of broken the generational rules of not talking about it. And now their kids are getting checked and are being far more proactive than I originally was. So what I've realized is that I've been taking personal responsibility and that um, what I'm supposed to control, and it's not them. And I but I how's the audio for that second half, guys?
You were good, and then you just at the very end there glitched a little bit, but we got 99% of it.
Not
So
forward
yeah, you're
that
glitching
makes
again. I think, John, we may have to just shift back to Maya for a bit, and then we'll hope we'll get you back in again here.
thank you, April. But
Okay. Sorry. So with, here we go. Increasing interpersonal skills. Part of the family dynamics is increasing interpersonal skills. When I say interpersonal, think communication between people. These skills are how people talk to each other, listen to each other, and understand each other. So words, tone, and body language. Skills that affect our ability to work and get along with each other include listening, empathy, teamwork, respect, and conflict resolution. Family systems therapists can skillfully help guide families to peaceful understandings and can help clients in these areas. Courage is the mental strength to venture, persevere, and withstand danger, fear, or difficulty. If you are here today, you have courage. Brene Brown is a social scientist and qualitative researcher who studies courage, shame, vulnerability, empathy, belonging, connection, and relationships. Her work looks deeply at interpersonal dynamics, how we connect or disconnect, why we hide parts of ourselves, which she defines as shame, and how vulnerability affects closeness in families.
John, do you
So,
want
how do
to?
we?
I'm sorry. Is
Oh,
that you or John on that one? I'm sorry, Maya.
is
uh,
what?
this
Do we
is
want?
me.
This is still
I've
John. I was gonna say we'll try him again because I know he came in and out. We'll see if he's any his audio is
Okay.
I
better.
I turned off my earbuds, so let's try the audio now.
You sound
And
good now.
okay, so we're just I appreciate the working through the technical glitches. So what I'm going to talk about now is like it's an intervention basically. And Brene Brown calls getting to wholehearted living. And what that is through her research, she found that wholehearted people have learned to dig deep. And that's a simple acronym that stands for deliberate, um, inspired, and going. And deliberate means getting deliberate with thoughts and behaviors. Inspired means to take new and different choices, and going is they take action. And so the goal here is loving and love, belonging, and worthiness. Isn't that what we all want in our families? And this information came from her book, The Gift of Imperfection, and I recommend it. I think Brene Brown's amazing, and I hope you guys get a chance to look at her stuff and see what works for you. Next slide. I'm not gonna go deep into the Kubler-Ross model, but I did want to address it because grief is something that we're gonna having a chronic illness. It's really healthy for us to learn how to grieve, and the losses involve health, ability, relationship, and the loss of loved ones. It's something that's normal for everybody in life, um, and but especially for us because we have more challenges than the average person. Next slide. So those five stages of grief are denial, anger, bargaining, depression, and acceptance. And these are the emotional responses people may experience when dealing with loss. If you'd like to talk more about this, I do have a slide for the question and answer section at the end. Uh, so we're living with a genetic aortic condition. They have there are physical and emotional challenges. It does impact the development of our family system, and I wish I understood what toll a chronic health condition takes on the family dynamics and mental health earlier in life. I wish I would have gotten the tools that I have now. Um, oh well, I can't change the past, but I can make a better future. Um, as I mentioned in the intro, I do serve at Camp Victory for kids, helping the youth in these early critical stages in their development. There's also a Marfan's camp for family in California and Atlanta. The camp, they're all. I have an additional slide for that too, if people want to talk about it in the second half of this. Next slide. So personally, um, uh, I use the biopsychosocial model, and this is a framework that has helped me better understand and manage my health. Um, Personally, I practice this model. It's comprehensive. It looks at biology, psychology, and social factors as they pertain to well-being. The bio is looks at our genetics and illness pathologies. The psycho looks at thoughts, emotions, and behaviors. And the social looks at components like social support and culture. Um, and when I do practice these things, I find that I maintain a much more balance in my life, which changes how I interact with my family. So next slide. So I here's our action steps going away from today. Well, there's actually many probably, but one is build a team. Have your healthcare professionals. For me, it's my main concerns are eyes, heart, feet. Each one of us a little bit different. Find a trusted therapist or counselor. Um, Recognize who your supportive family members are, friends, and your community, and invest time where you are loved and nourished. And oh, it didn't make it on the slide, but I have a quote from Jen Hatmaker, and it's there's only 24 hours in a day. We need to quit trying to be awesome and instead be wise. And, and coming from a recovering perfectionist, that quote means a lot to me. So in conclusion, let's take a deep breath together because we just took in a lot of information, like through our nose, outer belly, and just pulling on. In conclusion, mental health matters. Having good support and adaptation fosters resilience. Um, there's the three components that Brene Brown has found most important for wholehearted living is courage, connection, and compassion. And we're all learning to own our story, and this is a process for all of us. Today's been an honor to talk with you guys. It's actually my first time talking about mental health and genetic conditions. So, even despite technical difficulties, thank you very much. It's been an honor.
Well, Maya and John, we totally appreciate what you've both shared so far. I do see that we have one question in Q&A so far, and I just want to reiterate, especially for those who may have joined a little bit into the session, that if you have a question now, well, you can chat and interact with one another in the chat. The best place to put that question is in the Q&A. So we're going to answer this one live. How do you deal with a unaffected by VEDS caregiver guilt hypervigilance when the caregiver previously didn't believe the affected young adult before their diagnosis of VEDS? So how to deal with in parentheses, unaffected by VEDS caregiver's guilt slash hypervigilance when the caregiver previously didn't believe the affected young adult before their diagnosis of VEDS.
Are we asking about this for this is the caregiver who's asking, and they're trying to figure out how to cope with the feelings that they're having of hypervigilance,
I
or
believe
is
so.
this
Guilt and hypervigilance
okay?
because they didn't previously believe the affected young adult before they were formally diagnosed.
Hmm.
I think that having a conversation with the young adult where you apologize for not knowing and understanding before can go a long way with a relationship. Um, and that for kind of dealing with the hypervigilance that I think a lot of us have with these conditions, that therapy is a really great tool. What do you want to
Yeah,
add, John?
I was gonna say for recognizing, forgiving, asking for forgiveness, and then forgiving ourselves, but owning that to um, the few times that I've had family members apologize, and they're very few. It has meant a lot, and I would hope that same forgiveness and connection is restored and the hypervigilance is decreased. I too have dealt with hypervigilance at times, and it's like, oh, I can't go to sleep, or these intrusive thoughts come to mind. And so, learning like techniques to calm our nervous system, such as like deep breathing, meditation, um, things like that, and if you have access to a therapist that is it can guide you through the kind of part of that grieving process, um, coming to that acceptance of like, wow, my child has this. I didn't realize this. My stuff like that is nice to process and talk it out, get out of our heads.
We're all going to make mistakes. It doesn't like you didn't know what you were dealing with before. And so I think it becomes easier to not be concerned about something until you have a diagnosis. But if this makes you feel any better, I mean, it's been over 30 years since I was diagnosed, and I consider myself pretty well um, educated about it. My son broke his knee. He was on the couch and it just broke. And so when he started complaining about pain, I told him he was being like exaggerating. And for the better part of a week, um, told him to just ice it and take some Tylenol before we went to go see and get x-rays. So we're all going to make mistakes. I had to apologize to him for that one. We joke about it now. But give yourself some grace.
Yeah.
Well, thank you for those responses. We have actually now a bunch of questions, which are awesome questions. And I do want to say the person who was trying to get information on young adults just didn't fully understand your question. So if you want to rephrase it again, we're totally happy to answer that one. Okay. Um, so do you have any suggestions for handling dynamics of an unaffected sibling who starts to believe and behave as if they are affected?
Hmm.
So in terms of how to handle it with the sibling, and I'll be interested to hear your thoughts, John, but I think one of the big things is that we have to realize that we cannot control other people. We can only control ourselves. And so, if there are boundaries that you need to put in place because of, the anxiety that they're having or attention-seeking behaviors or things like that, you can't make them stop. You can't make them go to therapy or those type of things that may help them, but you can put up a boundary for the amount of time you're going to spend or the conversations that you're willing to have, and that's okay to do.
Yeah, definitely. I agree. And I was trying to determine like, oh, which um I was going to just separate helping them realize what's the unaffected child and what's the affected child, and almost like helping them kind of nourish their own abilities and and almost personalizing it. And I think that's a process of like kind of gradual changes as time goes on. But I
So
think
with that
pushing
one,
too hard will could
go ahead, John.
go on, April.
No, I was just going
Okay,
to say, I think with
April.
that one, it's okay. Reading the question there, I think maybe what they're asking about is it sounds like that child is sort of trying to be part of the dynamics, right? And fit into the picture, have more attention around themselves, right? Because they're unaffected. So I think it's the two part of how to best help the child that is unaffected cope and also how to be understanding for the child or other family members who are affected that they also don't feel that the attention that they do need medically and emotionally is being pulled away from them. So I think it is the two-parter there that they're trying to ask reading it.
Catch because the unaffected is there quite possibly could um element to this.
Did you say that again, John? I think we lost you for half a second there.
I'm sorry. Um
That's okay.
um the I think there is there's quite possibly an attention seeking element. So giving more attention to the child who's unaffected hopefully will meet that need.
Anything
I'm
else
glad
on
you
that one?
clarified April, John, because I had thought it was adults. So I had misunderstood your
Yeah, no,
initial.
I believe from what I read, I think it's off the screen now, unfortunately, but I believe it was a sibling, I think a child dynamic. And if I have that wrong, feel free to ask it again. Okay. So I have someone, I am affected. My two children are affected. How do I deal with my spouse who is not affected, not understanding my desires to parent a certain way since I am affected and have lived experiences?
John, do you want to start?
I think that's very common. I think that's going to resonate with a lot of the audience. And that's the first thing that comes to mind. Do your Maya, what do you hear?
Oh, I think that this is a thing where marriage and family therapy can be really helpful and having kind of a neutral party to talk through where both of you are coming from and kind of help you come up with a middle ground to help your partner understand kind of your lived experiences and your thoughts, and then help you understand what their concerns are too, may help you be able to compromise.
I I was leaning towards that too. Compromise and flexibility and letting each person uh function as they feel they need to within their own family system.
And I think that the foundation has a group for unaffected partners.
Yes, we
Um,
do. I'll be sure to put the link to that in the chat. Or Elva, if you want to grab that link for us from the calendar, that would be awesome.
so that may be a good resource for them too. I know my husband has participated in that at like the in-person conferences. And so that may be valuable for your partner to hear from other, lived experiences as well.
Hmm. Absolutely. And yes, Maya is correct. We do have a lot of groups. We have groups for parents. We have 50 plus group, but we do have a specific for folks who are partners, caregivers, spouses, and are trying to grapple with some of this stuff. So there's a lot of different support, all for free, all virtual, and no commitment. So we'll get some of those into the chat that may be helpful to y'all as we proceed here. I do want to clarify from the question earlier about hypervigilance in young adult. I guess I'm asking how to reconcile with an unaffected caregiver who is now hypervigilant out of guilt because they didn't believe the young adult before their diagnosis. So a little bit related to what you're saying with the broken leg there, but that's how do you find reconciliation with an unaffected caregiver now hypervigilant out of guilt because they didn't originally believe the symptoms that were presenting?
But my understanding is correct. This is the person who's affected who's asking kind of how to navigate the relationship with the adult. And if I'm understanding correctly, I think that you going to them if you feel comfortable and having a conversation where I don't know if they're looking for some absolution for forgiveness for missing things and you feel like you can give that, then having that conversation with them. Um, but also, as you're an adult putting up some boundaries with the hypervigilance is appropriate too. Not if you feel like you shouldn't share certain things with them, assuming, you're an adult, that's your prerogative.
John?
I'm thinking with hypervigilance, it's connected to anxiety. And so quite often when we're anxious, we're you think more elements can be added to the problem. So sticking to one element that they would stick to one single thing they want to address and that um because quite often provision um using their frontal brain it's kind of and they're trying to look for these all these different sins and then they put a bunch of other stuff into place and but really if they can just narrow it and confirm that hey we're um they can resolve one problem at a time.
All right. Anything else on that one before we move forward? Okay, this is a question that
I
I think.
guess if
Go ahead, John.
If I would say don't hesitate to getting professional guidance. Like life's hard, even without a chronic health condition. And so these are, and I liked how Maya talked about, well, there's finances and there's all these, there's there's 15 variables that can easily come into any of these problems. And then I just need to relieve all this stress. And so don't hesitate to get professional help. That's what they're there for.
And we do actually have some resources we share during Mental Health Awareness Month. If you're looking to get mental health support for the first time and you're not sure how to navigate the insurance side of that, so I will make sure that we include those in some of the wrap up for conference overall because that may be helpful for folks that are seeking that kind of support for the first time too. This question is one that I know will
April,
resonate. Yeah, go
can I add
ahead,
one
John.
thing to this first
Yeah,
thing before going on the next? We have a 30s to 50 group on the first Thursday of every month, and people are able to express. There's a nice dialogue, and maybe somebody could come there and process as being the affected one. The support group is for 30 to 50-year-olds who are affected. It's also free. And there's also a teen group, I think it's 18 to 30, if these are younger folks.
thank you, John. That is super helpful. So this question I know is going to resonate because we see it a lot, we get it a lot in the digital space. How should we deal with well-meaning friends and family members who use social media to find out information about our conditions or are finding misinformation on the internet? A lot of my friends and classmates see EDS all over TikTok and don't understand that it's very different than VEDS, even when I try to explain the differences, and it's exhausting. And we are so sorry for you that it's exhausting. We hear this all the time. You are so not alone in that. So Maya, what are your thoughts there?
I think it's lovely that they're trying, but I also understand where you're coming from, and especially with EDS, because there's so much hypermobile EDS content on social media right now. Um, and so one thing that you could do would be to say, this is the only place that it's going to be accurate. Go to the VEDS movement or go to the markfan.org or the Lois Eats Foundation, and please just get your information from there or ask me questions. And if I feel up to it, I'll answer them. And if I don't, then I'm not going to. Um, but that anywhere else is not going to be helpful because it's not going to have the most up-to-date, accurate information. And hopefully they will listen.
And I'm going to put into the chat for you all, for VED specifically, we actually have a great first person from Maya Fleener, who some of you may know, on VEDS and on why the V matters. That's a new thing we've started telling folks. It's a shorthand you can sort of explain to loved ones sometimes. The V matters. It makes a huge difference in sharing this piece with some people, of course, won't heed it, but it may be helpful to you. Thanks, Maya. I didn't mean to jump in there. I just thought of
Oh
that.
yeah.
John, what are your thoughts there on folks who just may have misinformation, maybe minimizing the condition based on stuff that they're getting wrong from the internet or stalking you on social media or whatever else it may be?
I would affirm them for caring, thing and trying, and then just express that, hey, that's either not me or please listen to me and my concerns because this is the condition I'm dealing with. And quite often it's personally like family members have thought like, oh, the problem solved. Well, not exactly. I'm still living with this. So, um, it looks different than help them oh, ask to be listened to. Go, this is where I'm at in my health condition. And as of now, can you push that aside and go back to some good sources of like um the actual foundation and I guess good material, good resources, good knowledge, and stay away from the other stuff, the fake news.
The fake news. Um, all right. So, and I will also try to pull while we're in the course of this. I know we actually have a resource, those of you who know Andrea on our team created that you can share with family members for how they can best help you. It's kind of an intake that you can fill out yourself, as far as what you want and need, and actually hand it to folks or send it to folks that you love. So I'll see if I can grab that. If we can't grab it during the session, I'll make sure we include it in some of the post materials. We do actually have another 5 or so minutes for additional questions. Anybody have anything else they'd like to ask? You can certainly put it in the Q&A and we'll be happy to field those.
While people are thinking of questions, I put in the chat that the American Psychological Association, if you're looking for a provider, that's one place where you can go in and put in your zip code, and then there's like you can pick if you want one that has like experience with chronic illness or experience with rural health issues or um, is a particular ethnicity, that sort of thing. And John, I was wondering if there's another resource that you recommend specific for marriage and family therapists, if somebody wants to have an MFT as their provider, where they would go to find one.
I use Blue Shield, and so you can call their mental health 800 number on the back of the card. And a Google search for like looking for the town, you can there's free group services. Here out in California, it's Catholic. The Catholic Services offers some. They're actually pretty good. I went to check out a few of them. A Actually, local churches have grief and support groups also. Um, and those are the first ones that come to mind.
That's great, John. We really appreciate that. Let's see. It looks like we did get another question. Okay, what boundaries do you think are best to establish with family who tend to be too involved in the affected person's care? Great question.
Great question.
First is limiting the amount of information they have about the affected person's care. So um, if you can, not sharing when a doctor's appointment is coming up, or not having, you don't have to share those results with them. You don't have to update them. Sometimes that might be putting a filter if you're going to share some things on Facebook, filtering out who has access, can kind of be like a first line way of handling it. John?
Uh, Gently, like if somebody is uh in their fear trying to basically hold down or stifle the um somebody that's affected but trying to live within freedoms. Like I keep thinking sports because sports is such a a dicey, like how do I do sports? How do I actually the Marfans page of like, hey, you're allowed to walk, you're allowed to cycle, you're allowed to swim, do gentle yoga. So if it's something like I've heard moms who want their kids to do nothing. And it's like, well, hey, I'm a kid that just wants to be active. And so there's a happy median there. And I think that ties in with like the adaptive lifestyles, which is crucial because doing nothing isn't a solution.
And I would say to your point, John, we have a brand for anybody who doesn't know, brand newly updated this year by our Genetic Aortic Network Education Working Group resource on physical activity that may help, beyond the boundary setting. To John's point, if there are folks that are genuinely worried or aren't sure what the parameters are, it's all about shared decision making now between patients and healthcare teams. And so while that doesn't solve the emotional mental health side of folks who are overstepping boundaries, it may help when people have practical concerns to allay some of the sort of historic fears. I think even our materials for many years sometimes were more restrictive because they were based on competitive athletics versus based on a kid having fun in PE, right? So I'll plop that in the chat as well for you. These physical activity guidelines, we're finding a lot of families and individuals are finding them super helpful because they really are about emotional well-being and setting boundaries and shared decision making. So stuck that in based on your comments. All right, well, it looks like we're just about at wrap up time here. John, Maya, any closing thoughts before we start to do kind of the final housekeeping?
I'd say
Thank
I
you.
highly recommend um, therapy to help manage these issues. Um, and so finding somebody virtually in person, whichever works for you. There's a lot of different ways to access therapy now. And then just remembering that your locus of control is you and not able to control others, but we can control our boundaries.
That's such great advice. Maya, first of all, you are such a treasured member of this community, treasured advisor to our board. So thank you so much for being here. We're always so grateful to you. And John, what did you want to share?
Um, Finding freedom. I agree with everything Maya said, and April, you've had great insights on this, so thank you. But finding freedom within where you're currently at with your condition, um, is key. It's like really getting rid of the fears and replacing it with courage, and be like, and it's and just living your best life, your wholehearted life, despite having a chronic illness. Um, and thank you for letting me share today.
John, I just love the way you answered so many folks and with such a gentle, holistic sensibility. We are always so glad to have you and really appreciate your expertise today. Thank you so much. I'll just read through the housekeeping. These sessions are recorded, as we mentioned at the start, so you will be able to rewatch if you'd like. They're initially available on our the Zoom homepage, and then they'll all be on our YouTube channel, which is just the Marfan Foundation on YouTube. And if you weren't able to get a question answered today, you can always be in touch with our Help and Resource Center. That's at marfan.org/ask. And I want to emphasize that marfan.org/ask does work for VEDS, Loeys, Dietz, Stickler, and any related conditions. We thank you so much for joining us. It takes courage to come into a setting like this and ask your questions. And we so appreciate your sharing a little bit of yourselves today, every person that participated. And again, John and Maya, you are treasures to us. Thank you so much for being here. We appreciate you all. Take good
Thank
care
you.
and on to the rest of conference. Thanks all.
Bye.
I guess.
Bye.